about having you here today. I want to thank the Teamsters. Let's hear for the Teamsters. I want to thank SEIU. I want to thank the House of Labor who have been so supportive and being out there and making sure that their membership gets the facts. Let's hear it for labor. You know, I simply believe that access to health care should be a right for all Americans. For millions of our citizens, hardworking Americans who pay taxes, who have made our country the greatest on earth, health care has become, unfortunately, a luxury. Because we have a system that's driven by profits, not by what's medically necessary for people. Our healthcare system's broken, it's sick, folks, and it needs to be fixed. We need to heal it.
80% of the people are happy with their health care.
I'm here today because I support health care reform. I support a public option for insurance. I, like you, believe that every Minnesotan, every American should have access to quality, affordable health care. I support the hard work that Minnesota has done to make sure that we are working towards every resident of Minnesota having access to health care. And we need to do that in the United States of America. I believe in a country where our citizens should be healthy, where they should be productive, and where they should be able to access affordable, quality health care. In the House of Representatives, we are working on legislation to reform our health care system, and in 2009, we will pass health care reform. We will strengthen Medicare for our seniors. We will make sure that every child in America has health care coverage because they deserve it. We will work together to eliminate waste and unnecessary costs that are driving up your health care premiums. And I want to say again, I will work hard to create a public option so that there is real competition in the marketplace. And in the marketplace, you know when you buy an insurance policy, it will be there for you when you need it. State this clearly. If you love your doctor, and right now I love my doctor, and you like your insurance plan, nothing needs to change. You can keep what you have if you're more than satisfied with it.
Well, you
healthcare reform. There are people who say that the richest, most powerful country on earth cannot afford to provide health care for all of its citizens. There are opponents who want to protect profits before they protect the right of people to access health care in this country. Now, insurance companies had a skyrocketing quarter posted. They saw their profits go up. They want to protect those profits. I want to protect your right to access health care. So let me tell you, we're going to eliminate insurance companies who put forward pre-existing conditions to keep you from accessing care that you pay for. I want to put to an end the insurance companies rationing your health care. just want to kill the bill. They want to prevent us from moving forward to make sure every American citizen has the right to access health care. Now remember, you need to remember, these are the same people who brought you the misinformation that led us to the war in Iraq. These are the same people who were saying we needed to privatize Social Security before the financial crisis. And these are the same people who said we did not need to watch what was going on in the mortgage industry. Well, that spells disaster, then the party of disaster, and I'm not going there, and either are you. So for those who oppose reforming health care, I want to make it perfectly clear. I support Medicare for our seniors. I support government health care for our veterans who have served our country. And I support the health care that right now is saving the lives of our troops in Iraq and Afghanistan. And I support the efforts of Minnesota and Minnesota Care.
Go Betty!
Because I believe every child, every family, every senior deserves to live in dignity, deserves to live with respect, and they need to have their help in order so they can contribute their skills to our country to make it stronger.
That's right.
So that's why we're here today, to work together to pass health care reform. And I'm so proud to have you out here because we have to speak the truth. The misinformation has to stop. Because while the media focuses on misinformation, the stories of families who have their health care taken away from them when someone is found to have a heart attack and the insurance company says, I'm sorry, that's a pre-existing condition. We're not going to cover that.
Yeah.
Or they're capped. They thought they had insurance and they're capped. At that time, that the chemotherapy is maybe starting to make a difference in their life. Or they just lost their job and they've been paying taxes and they're trying to figure out how they're going to do the house payment and the health insurance payment.
That's right.
Yeah.
Or they just found out that they had a child, a precious life, delivered to them into this world that is going to have what the insurance companies are called a pre-existing condition and make that young child uninsurable as it grows up and to be an adult. So you're here today. You're here today to speak to the truth. You're here today to stand up for children and families and seniors to make sure people live with dignity. And I'm so proud of all of you. Thank you for being here.
Way to go, Betty!